Okay, so this is when we talk about license to heal, and of course, when you look at the book, I didn't do nearly as good of a job as they did, but that's why the little diagram is up there. If you
I
look,
love it.
this is for oxygen, glucose, and stimulation, and these are the other parts of the metabolic aspect of it. But see, this license to heal is we have to marry, and this is called the neurometabolic web of dysfunction. So when all of these are working together, we have proper function, proper regulation, healing of the body. But when you literally take any one of these here and they falter, we start to set up for a neurodegenerative demise. And it's not, the license to heal is basically untangling the web of neurometabolic dysfunction. And then when patients have these chronic debilitating health problems, I want them to understand that it's not going to be one of these things that we're going to solve. We have to solve this whole dynamic here.
They're all connected.
Yeah. And see, every human being is going to be completely different. Every human being is going to have a unique system that we have to activate to help them. And it's like one of the patients that's in the book, she was having seizures. She was having 15 to 20 seizures a day. And at 21 years old, she had to drop out of college. She had a soccer scholarship. She was having seizures. And the amazing thing about this is she was actually in Tennessee at a school where I actually had helped another seizure patient years prior. So anyway, they were able to meet, and she said, you need to go see Dr. Barlow. And she had been to all of the so-called experts. And I don't mean to be rude or, discredit, anybody, but it's like, if you're putting yourself out there as an expert, you actually need to be helping people. And, she's like, well, I went to all the experts. And I'm like, well, with all due respect, no, you didn't, because if you went to the experts, they would have fixed you. And she came in here, and what we did is we looked at this entire neurometabolic web of dysfunction, and we found out through metabolic testing, which means blood work and gluten sensitivity and autoimmune disorder, what's actually deficient. And we drove the deficient systems. And now she went from 15 to 20 seizures a day down to 0 seizures a day. And it did take about at least 6 months. I don't know the exact time, but 6 months to take it from 20 to down to 0. And she's actually was driving to the clinic in the last parts of the treatment. But that's what License to Heal is about, is looking at the entire neurological web of dysfunction and finding out what is it that's causing this person to live less than full out and full on life.